Hi Vanessa, this is Dr.Srikanth from team MDS CONQUER. Now I'm back here to continue MDS CONQUER Neet 2020 RECAL. So the subject of discussion is going to be community. So the question number 1, a group of 4 to 8 experts discussing about oral health to prevent dental caries in front of a community. What type of communication or discussion it is? Hope you learned these different types of discussions, that is the panel discussion, the group discussion, the symposium, role playing or social drama. Okay, so before going into the right answer, we'll learn few important aspects. So first of all, we'll learn about what is symposium. Symposium is generally what you regularly encounter in your PG life. Okay, so once you start your PG, they're going to keep some symposiums. What is actually the symposium? Symposium is they're going to give a single topic, and a series of students or the speakers are going to discuss on the same topic. So all the sessions are going to be like 5 or 6 sessions are going to be on the same topic, and the speakers are going to brief their point of view related to the particular topic, and there is no discussion among the speakers, but at the end the concerned person, okay, the concerned person is going to come out with the conclusion and summary. Okay, so in the end, the audience which are around them, they can ask few questions related to this. Okay, so this is all about symposium. Symposiums are regularly done on a single topic. The speakers are going to discuss. The next thing is the group discussion, and most of you are well familiar with the group discussion. So in this diagram, you can see most of the people are their position, the chair positions are in circle. Okay, so a group is an aggregation of the people interacting in face-to-face situation, and the maximum size of a group should not be more than 12. The range is 6 to 12. So it's an important question again. Okay, the process of identifying the problems, and they have to find a solution to the problem, and the participants in this, they sit in the circle position. You can clearly appreciate that in the diagram, and there will be a leader for this, the group leader, who is going to initiate the subject, or who is going to describe what are the concerns or what are the solutions, what are the questions for which you have to get the solutions by which, and he always encourages everyone to participate in that particular session. And the main disadvantage is unequal participation. Few people who react or involve more in this group discussion, and few people they will be skipped or they will be ignored in the discussion. So that's the main disadvantage of a group discussion. But the concerns or the points to be noted is the effective size. The effective size is going to be 6, and it ranges to maximum 12. Okay, and I mean, like, what is the leader is going to do? Okay, the functions of the leader is going to initiate the subject, or prevent the side conversations among the group mates, and always encourages each and everyone to be a part of this. The main disadvantage, you have to make a note about the disadvantage. They can ask the disadvantage related to the group discussion. The next one is panel. Okay, so these are the lines which are taken directly from your Shobhan Peter, and the question is being prepared in such a way. Okay, so the first line from Shobhan Peter clearly says that a panel discussion is a panel, means something like a group of 4 to 8 experts sit and discuss in front of the audience. Okay, so they are going to sit and discuss in front of the audience. The audience are allowed to ask different questions, and the chairperson sums up the different views from the different people. So it's an experts panel of 4 to 8 sit in front of the audience, and they're going to discuss about the particular topic from their viewpoint of view. Okay, so this is a question that is given. The answer for this question is panel discussion. And last but not the least is role playing or socio drama. Okay, and this diagram is related to the socio drama. Okay, so the size of the audience or the content should be around 25. The audience should take active part by suggesting the alternative solutions and even taking part in the drama. Okay, and this type of communication is more effective. So please do add this key point, that is, it is more effective. And whatever this is a diagram based question of puppet show. Puppet shows are generally they are more familiar in the villages, and this is a type of socio drama, and this is most useful in the children health education. So please do add or highlight this particular point. Okay, this is more effective and useful in children health education. So the answer for this particular question, which is given in the NEET, the answer is panel discussions. So going to the next question, the process of investigating the healthy individuals with the objective of detecting the unrecognized diseases or its precursors in order to take the preventive measurements or delay the development of disease or to make the prognosis better is termed as. Okay, so it's termed as, this is a definition of screening. Okay, the answer is screening. It's a simple definition of screening. Screening is a process. Purposefully you're going to identify the unrecognized individuals or undiagnosed, clinically undiagnosed individuals by which you are going to identify the screening. So screening is useful for prevention. Screening is useful to make your treatment or your therapy more effective, and the screening is used to make your prognosis more effective. So when you're talking about screening, this is a WHO definition that is taken from the textbook. So just for your academic purpose, you can add a note of this, which is almost same as the question that is given in the NEET. Okay, so just read it off and just try to understand. It's almost the same, the definition. But screening, the main useful uses of screening is, screening helps in identifying the risk factor, identifying the genetic origin of the disease if the disease is genetic origin, identify the precursors or the etiology, and helps in early detection. So when you detect the disease early, your treatment can be more effective and your prognosis can be better and better. Okay, so and coming to the screenings, the medical screenings are categorized into 3 types, that is mass screening, where entire population is screened, and multi or multi-phase screening, okay, which involves the use of various screening tests in a sequence manner. It's almost like your multi-phase sampling technique. So one level to next level. For example, if you are planning to identify a person or a group of people who are having the TB, the first thing what you need to do is, first of all, you need to see the clinical features. So once you collect the people who are having the clinical features, then you are going to have some basic test, okay, some basic test which helps in identifying few people. Then you're going to move to the next level. Okay, so this is how you can move to the basic test to the high-end test, and this is done in a multi-phase only in a particular group of people who moves from one phase to other phase. Means once their test was positive, only the positive tested people will be going to the next level. Okay, that is called as multi-phase or multiple screening. And next one is prescriptive screening technique. Okay, this aims in early detection of specific disease that can be controlled better, which is specific to a specific individual. Okay, so these are the different types of screenings. Better to make a note rather than leaving this, because the question was basically moves around the simple definition of screening, which is a most commonly uncounted question. The next comes, okay, this is a like study related question, okay, which is already discussed. You can go back and check your cohort and the case control study, which is there on the YouTube channel. Okay, you can just check it off. But the question is very simple. A group of pregnant females who were selected from the population and their follow-up. Okay, so you have done a follow-up to evaluate the risk of development of anemia. So you have taken the pregnant women, okay, then you kept them under follow-up for 9 months, that is the pregnancy period, 9 months, and then you have tested whether they have got anemia or not. So you are moving forward. So what is forward moving study? Forward moving study is the simple cohort study. Okay, so it's not case control. Okay, okay, both options are eliminated. So you have to go for cohort study. Okay, you have 2 options related to the cohort study, but you clearly know that cohort study is a prospective study which is moving forward, whereas your case control is a retroprospective study which is moving backward. So it is a prospective cohort study. The answer is B for this particular question. If you want to have a good details of the differences between the case control, cohort, or the examples related to the dentistry and everything, you can just go back to our YouTube channel. Okay, click your case control and cohort study. Okay, you will get it. You finish the video, and probably I'll try my best to post the links of the video in the description. The next question moves on the sampling technique. Okay, so there is a video related to the sampling technique also. Okay, the sample and sampling technique, a video of 15 minutes. Please go and please try to finish that. Okay, but it's a very simple question. If we need to select 10 students from a class of 100, what is the best technique of choice? It's very simple. Like if you know the meanings of all the 4 options which are given in the question, it's very simple. The answer is systemic sampling technique. Okay, the answer is B, and I'll try to explain it with examples over here. Okay, so stratified sampling technique is very simple. Like you are going to take a sample of 100. Okay, similarly I'm going to tell you for a school, so in which you are going to divide the students into different groups. Okay, for example, people on different colonies. For example, a school has surrounding 10 colonies, and students are from the 10 colonies. So you're going to divide the students on 10 colonies. Once one colony will have 5 or 6, 15, 20, something like that, all the 10 colonies, and you're going to select a particular group of individuals from each colony, 2 from here, 1 from here, something like that. So this is called as, you're going to divide them into subgroups, then you are going to do the random sampling technique, that is called as stratified. You're going to divide them into stria. The next one is cluster. Cluster is very simple. First of all, you're going to divide the people into clusters. Same example I'm going to give. For people of different colonies, 10 colonies you got. In the previous study, what is that stratified? You have selected the individuals in each colony. But here you are going to select the colony, entire colony. You're going to take the sample from entire colony, means here the sample is cluster, means group of people. Here it is, the sample is random, means only one individual. Here it is one person from each cluster, or few persons from each cluster. Here entire cluster is taken, okay. And of course you know the meaning of convenience sampling. Convenience sampling is something called as accidental sampling, means basing upon your convenience you have selected few people. Like for example, if I'm doing a study, I am more convenient if I take people who are more convenient to me. For example, I love to take my own students in the study so that they will hear my words, or they will be under my control. So that is what my convenience is. So that is called as convenience sampling. So very simple, just by knowing the like the terms, you can easily answer this question. The answer is B for this question, B. Okay. So next question is, of course, once again you have encountered a very simple question, that is the association between the iodine and gout is an example of. Okay, so what is association? The first thing you have to make a note, what is association? Association means a connection between two factors. Okay, one factor, how it is connected to the second factor. So a simple definition says that it is the co-occurrence of two variables. Definition according to the textbook is, it's a co-occurrence of two variables, right? So there are 3 types of associations: type 1, type 2 and type 3. Type 1 is suspicious association, type 2 is indirect association, type 3 is direct association. In this direct association, again you have 2 types. One is one-and-one association, second one is multifactorial association. I am going to give example. Suspicious association means it starts with letter S. Okay, it starts with letter S. Suspicious association means you are suspecting, but it may not be true. It's not true, but without any knowledge you are suspecting. For example, previously in the old era, like 20 years back, we have a norm that when you give birth to a baby in the hospital, the death rate will be more when compared to the birth in the home. So it's a norm, okay, but it's not true. Logically to speak, the death rate will be more when you give birth in the home, but they have a norm that they have some suspicion which is not true. Okay, so that is called as suspicious association, which is not real or not true. The second one is indirect association, means if the causative organism is not the primary agent which is responsible for the occurrence of disease, but further like as investigation goes on and progress, you come to a conclusion that this factor may also have an indirect effect on the occurrence of a disease. Means it is indirect, not directly associated, but it is going to cause disease. So it's indirectly going to cause a disease. So that is called as indirect association. I'm going to give an example. For example, if you talk about the same example, the people are living in high altitude, and the high altitude people will get goiter. but it's not direct association. Indirectly, it is indirectly association. What is directly associated for occurrence of goit? That is iodine deficient. Iodine deficient. Iodine deficient is a direct cause, but indirectly your high altitude may cause goiter. This is an example of indirect association. Okay. So coming to the direct association, 1 and 1. 1 and 1 means only one agent is responsible for occurrence of a disease. For example, if you take a particular bacteria, okay, that is HIV. HIV is caused by HIV virus only. Yes, right? So it's 1 and 1 association. It's 1 and 1 association. For example, if you take multifactorial, caries is a multifactorial disease which depends upon many factors. So caries association is not a single 1-to-1. It is a multifactorial association. And similarly, you can take your hypertension or cardiac problems. Most of the cardiac problems are related to obesity, your lifestyle, your food habits, and all these are called as multifactorial association. Okay, right? So I'm going to give one good example, okay, which is given in the examination. Your iodine deficient is going to cause goit, and this may lead to thyroid adenoma. Okay. So the association between these two is direct. For example, if they are giving an option, what is the association between iodine deficient and thyroid adenoma is indirect, because it's going to cause goit, and the goit may leads to thyroid adenoma. Okay, so the association between iodine and this is indirect, whereas the association between iodine and goit is direct. So the answer is direct association. It has a direct association. Hope you are clear with this 3 types of associations and the definition of association, and make sure you learn some good examples. Okay, 1-to-1 are mostly measles is going to cause measles disease. Okay, so I mean like that is 1-to-1 association, right? Direct. The next one, again, most commonly discussed, regularly discussed in the classes. In a class of 100 students, if the ranks are given basing upon their annual performance, from rank 1, they are telling ranks means 1, 2 positions, some gradings. Grading is a better word for this. Grading means you are grading rank 1, rank 2 is a grade. Okay, it's not percentage. If they are giving percentage, it's going to be different. Like for example, out of 600, or we'll take your NEET exam into consideration. Out of 960, how many marks you got? Okay, how many marks you got? That is number, that is different. Corresponding to that number, they are giving rank or they are giving grade. Okay, so what type of? So first of all, learn what are the different scales. Okay, I hope most of you are familiar with this. Okay, the different scales are, the first one is nominal scale. So what is nominal scale? There will be no specific order for this. Scale. Okay, so regularly what we do, okay, male or female, okay, or boys or girls, or like what is from which country you are, all these questions are called as nominal scales. They don't have a specific order. The second one is ordinal. So ordinal is also qualitative. Nominal is qualitative, right? Nominal is qualitative. Ordinal is also qualitative. Okay, but this has order, specific order. For example, if you take TNM classification, it has grading. It is called as grading. People of a classroom are divided into grades: A grade, B grade, C grade. People of a classroom are divided into ranks: first rank, second rank, third rank, fourth rank. And similarly, like if you take the severity of a disease, hemophilia, you have severity of a disease, very severe, or your hypovolemic shock, you have different severities. So all these severities are going to come into this ordinal scale. Then the third one is, you have to make a note, the third one is metric scale. Metric scale is a number. Okay, hemoglobin percentage, temperature of an individual, marks of a person in the examination, all these are metric scales. So again, in these metric scales, you have 2 types of scale. One is interval scale and second one is rational scale. So interval scale is very simple, that it doesn't have absolute zero value. No absolute zero value, and no ratios are used. The best example is temperature in centigrade and temperature in Fahrenheit. You don't have 0 degrees centigrade. You have 0 degrees Kelvin, but you don't have 0 degrees centigrade, 0 degrees Fahrenheit. So there is no absolute zero value, and this cannot be used as a ratio. Okay, whereas your ration is, you will have absolute zero value and you have ratios. The examples are your HB, your temperature in Kelvin will come under this category, okay, and your marks will come under this category, right? So these are the other types, okay. So make a note about the different scales which are very, very important in your examination point of view. The next comes, of course, this is just an extension of the screening what we have discussed. Examination using a tongue depressor or available illumination source comes under which type? Simple, the answer is type 4. We are going to discuss all these types. Okay, coming to the type 1. Type 1 is called as complete examination, where you are going to use a mouth mirror, explorer, light, radiographs, percussion, palpation test, pulse vitality, study model, lab test, everything. You use everything. And coming to the point to be noted, this is not often used in the public health. It is regularly used in the diagnosis of a particular disease in a well-equipped clinic or a well-equipped college. And the second one is the type 2 is the limited examination. Type 2 is the limited examination. That is your mouth mirror, explorer, adequate light, and the posterior bite wings are used. This is of greater importance in the public health programs combined with service to the individual patient who is at a particular risk. Type 3 is inspection examination, where these three are used, and make a note, this is the most commonly used in the public health sector. And I hope you remember this type 4, what we used to do. This is called as screening, what we used to do in your public health programs. Once you go out to a particular village, what do? You use a tongue depressor, available light over there, and you are going to check the patient by giving the individuals who really required the treatment. Okay, so make a note, but this is too unreliable for the public health survey. So basically we have to, the most commonly used or the preferable thing that to be used is type 3. But the question is very simple. Tongue depressant and available light are most commonly used in which type? That is screening, that is type 4. The next question is very, very simple question. Okay, I mean, like most commonly encountered in your basic MCQ books, and regularly we discuss it. What is the particular phenomenon? Chalking off phenomenon. Okay, so what is this? Like whenever you apply HAF, so whenever you apply HAF, the tooth has the maximum content called as hydroxyapatite. This hydroxyapatite has calcium in it. So what happens? This fluoride is going to react with the calcium to form CAF. So this CAF is so resistant, and it forms a reservoir over the outer surface of the teeth. So for example, if you take this as a as your teeth, so whenever you apply the topical fluoride, this CAF is formed on the outer surface like this. For example, the red color is CAF, and it forms as a reservoir of CAF, which makes very resistance and does not permit any further fluoride to come inside. The fluoride, this red color is something that's going to act as a barrier and will not allow the fluoride, the green color fluoride, to enter in. So this is what is chalking off phenomenon, and it is very predominant and common with NAF. Okay, so NAF is the answer, C is the answer for this question. But how you can overcome this? Very simple. So that is the reason why whenever you apply NAF, you have to wait for 4 minutes to dry off. So when it dry off, what happens? It's going to dissolve in the oral fluids. This CAF is going to dissolve in the oral fluids, and this red color area will be removed. Okay, and the fluoride outside will be entering inside. So this is what chalking off phenomenon, what precautions we have to take to avoid this. And of course the second important area is it is most familiar or common with NAF. The next question, of course, a very easy question for most of the final year students, because this is one of the important exercise in your final year community examination practical. So according to the cptn index, if the pocket is 4 to 5 millimeters, what should be the treatment done? Okay, so this is the question. The answer is scaling and root planing. The answer is C. We'll discuss. So before going in detail, we have to learn what is the cptn probe. Most of you are well familiar with this cptn probe, but cptn probe is basically of two types. One is epidermology and second one is clinical uses. Clinical uses will have more markings. Clinical uses will have more markings. Here you can see more markings, and the epidermology uses will have less markings. So what are the markings for the epidermology? You will have markings only at these two markings, that is 3.5 to 5.5 is the marking that is present, and the ball is 0.5 millimeters diameter, and the weight of this is 5 grams. The weight of WHO probe is 5 grams. The other names is, it is called as ball end probe because it has a ball at the end. They can ask you the diameter of this ball end probe, that is 0.5 millimeters, and this is also called as TRS 621 probe. This question was already asked, make a note. This is also called as TRS 621 probe. So this is E probe. Okay, so what is C probe? Clinical uses probe will have more markings. Apart from 3 to 5, it has 8.5 and 11.5 markings also. Okay, it has 0.5, 3.5, 5.5, 8.5 and 11.5 markings. So that is the difference between the clinical probe. Clinical probe is used in the clinical scenarios. Epidermological probe, E probe, is used in the epidermological scenarios when you are testing more population. Next goes, okay, so go back and just please try to read everything which is given in the Schopenpeter. I'm just focusing more on the codes and the treatments. Okay, so what is the coding? So you have a different coding, that is X, 4, 3, 2, 1, 0. Very simple. 0 is no signs of disease. 1 is gingival bleeding. 2 is presence of calculus. 3 is pocket of 4 to 5 millimeters. So normally you will have a normal range is 2 to 3 millimeters pocket will be there, right? So if they are asking perio related question, what is the histological depth of the pocket? Sorry. So what is the histological depth of the pocket? Means it is 1.8 millimeters. Ideally, in a healthy individual, in a healthy gingiva, what is the depth of the pocket? Healthy, what is the depth of the pocket? 0 millimeters. Clinical probing range is 2 to 3 millimeters. So if it is 4.5 millimeters, or when the gingival margin is on the black area of the probe, when you are comparing with the probe, anything is same, okay, that coding is 3. And if it is more than 6 or the black area of the cptn probe is not at all visible, then the coding is more than 6. If when only one teeth or no teeth are present in a particular 6 set, okay, or the third molars are excluded unless they are functional in the place of second molars, then you are going to CX. CX is not that important, whereas your all these 4, 3, 2, 1 and 0 are important. So basing upon these codes, you have to plan your treatment, that is called as TN. So what are the TNs? TN0 is for code 0 or code X. There is no need of any treatment. TN1 is code 1, that is you have to advise the patient to improve their personal oral hygiene. 2A is code 2, where you have to advise scaling plus personal hygiene. 2B is code 3, scaling and root planing plus personal hygiene. So they have asked a question on code 3, that is they have given the value is 4 to 5 millimeters, means which is reflects the answer as code 3. So what is the treatment for code 3? Code 3 is scaling and root planing. TN3 is code 4, where you have to go for a complex treatment apart from improving the scaling. That is, complex treatment needs nothing but you have to go for flap surgery or some surgical procedure plus scaling plus root planing. Clear? So the question is 4 to 5 millimeters. So the answer is scaling and root planing. If the option is given as more than 6 millimeters, then the answer is going to be the code 4 or treatment required 3, that is called as complex treatment and apart from improving the oral hygiene. Okay, the next question. According to Stephen's curve, the pH above which remineralization occurs. So if you take remineralization and demineralization cycle, so this is demineralization red color and this is remineralization green color. So the pH above which above which the demineralization will occur. So it moves around 5.2 to 5.5. 5.2 to 5.5 is nothing but is a critical pH. So below 5.2 to 5.5 demineralization occurs, above 5.2 to 5.5 remineralization occurs. Okay, so the value should be somewhere near to 5.2 to 5.5. The only one option is there. The answer is C. So you have to make a note, the critical pH is 5.2 to 5.5 and the critical period is 10 to 40 minutes. So mostly after a period of 1 hour or 60 minutes, it drops to the original pH. What is the normal pH is 6.7 to 7.2. So this is a question which is a normal basic question. When they ask the same teeth or tooth which is treated with fluoride. So whenever teeth is treated with fluoride, it forms hydrofluoroapatite or fluorohydroxyapatite. Okay, so fluorohydroxyapatite has a lesser critical pH. So normal critical pH is 5.2 to 5.5. So fluorohydroxyapatite critical pH is 4.2 to 4.5. So they can ask critical pH of enamel. So regularly whenever they don't mention the outermost surface of tooth or teeth is enamel, so we consider it as enamel 5.2 to 5.5. Or when they ask dentin is 6.2 to 6.5. They ask cementum is 7.2 to 7.5. So it's just jumping. Fluoride treated is 4.2 to 4.5, enamel normal is 5.2 to 5.5, dentin is 6.2 to 6.5, cementum is 7.2 to 7.5. It's very easy to remember. And just make a note about these studies and evidence-based things which are related to dental caries, and the most commonly asked. So already we have covered this in our power play books. This study is covered, this study is covered, this study is covered, this study is covered, this is covered. So this is very, very important textbook reference, and I want everyone to finish this off at any cost. Okay, very, very important. They can ask questions over this area. Again, the next question is on dental caries. So dental caries is, of course, you know that the most common disease in dentistry is dental caries, and of course they will ask a decent number of questions on this on this topic or on this disease, and I want everyone to just try to focus, try to learn as much as related to the dental caries apart from the basics what you have related to this. So the question is most sensitive. Okay, so it's a direct line taken from the book. So the most sensitive is surface. Okay, it's not tooth, it is surface index is the most sensitive. So I'm trying to collect all the indices related to the dental caries. Okay, I'm going to post a notes preferably as soon as possible. So we started collecting the things and we'll be posting on it as a reference source. So please try to finish that PDF which is going to be posted on the group very soon. Okay, so this is all for now related to the community part of NEET 2020. So this is our Telegram page. Okay, the link will be shared in the description. If you want, you can be a part of this. This is our Instagram page, MDSCONQUER_NBDCONQUER. Okay, where we are going to discuss the diagram based stuff and everything. Make sure you try to follow this, and of course we are planning to have a free all India mock examination. Like the date will be announced very soon, and we are going to give a free e-booklet. Okay, and make sure you drop your email address in the comment box to get the booklet in the month of November. Yeah, love learning with Team MDS Conquer. Signing off, Dr. Srikanth.